Well, I'd like to welcome everyone to this week's webinar. We have a special guest today talking about Medicare, and I know there's just so much confusion out there, and I believe the enrollment period started October 15th, so I felt that this was a good time to talk about Medicare and the different changes of the program. And so if you don't know who I am, I'm Bruce Rosenblatt of Senior Housing Solutions, and I provide advice for people who are thinking about senior housing either now or in the future. So if you or if you know of anyone thinking about senior housing, please have them reach out to me. This is what I do. This is what I've been doing for 30 years. And so I really appreciate your referrals. So I as a resource to everyone in the area, I try to provide different speakers and different opportunities for people to learn. And so today it is my pleasure to introduce you to Carolyn Marks of Logical Solutions. Carolyn is an expert on Medicare, and so she's going to unravel the mystery of Medicare. So Carolyn, I truly appreciate it. And everyone, I know we're having a little bit of an audio issue with Carolyn's mic, so she's promised to speak up the best she can. But we'll just try to get through it the best we can. It's the world we live in today. So welcome, Carolyn, and we're anxious to hear what you have to share.
Thank you very much, Bruce, and welcome to everybody on the Zoom call. I've been doing health insurance for about 10 years now, and what I do mostly is educate people. Folks are so used to having whatever their employer has offered them, they haven't had to think much about what it is their choices are. They might have a choice between a high or a low plan, something like that, but they don't have to figure out the details. When Medicare time comes around, that's a different story. You get just a boatload of mail, and there's tons of advertising, and it can get very confusing. What works for one person may not be the best solution for another person. So it's important to know what Medicare does and does not cover, and the choices that you have with it. So if you've worked 40 quarters, 10 years, and paid into your Social Security, you have paid already for Part A. What does Part A cover? I like to think of the letter A as a roof, and everything that has a roof is covered. Hospital, rehab, hospice. It does not cover long-term care in any way, shape, or form. That's something that's a common misconception. Part B, you will have to pay for when you start Medicare. B is doctors, inpatient services and medications, blood, things like durable medical equipment such as wheelchairs, walkers, and so forth. You also have to have a drug plan along with that, and there are two ways to get that. We'll get to that in a minute. Since 2006, people have had to have a drug plan. It's a requirement. Some folks tell me, well, I don't take any medication, so therefore I don't need one. However, a penalty will start to accrue for every year that you do not have a drug plan. I like to use easy math and say that's roughly $5 a year for every year you have not had a drug plan. And so if it's been 5 years without one, times $5 is you're going to have a penalty every month from there on of $25. So most people don't like to run into that. What I do is if they take few or no drugs at all, we write them the cheapest plan out there, which for 2021 is $7.30. It's a good thing to go over your medications once a year because everyone's needs change, the plans change. Things can go from brand name to generic and so on and so forth. So I like to do a review with my people once a year. So Bruce, you want to show that first slide there? Good. So here we have original Medicare. That's the slide at the top. It'll be a red, white, and blue card for you. You've paid into A. You will pay a premium for B monthly. It's under $200, and but if you do make more money, they're going to raise that on you. So that's your 80% coverage. That is covered. 20% is not, and 20% can be a big number. So folks usually adopt another plan on top of original Medicare. So beneath you see option 1, which is a Medicare supplement insurance. This can cover just about everything that Medicare does not. And we'll look at that in more depth a little later. Medicare Part D is a separate plan to go along with that to cover your Part D requirement. Option number 2 is a Medicare Advantage plan, sometimes called Part C. It's a whole alphabet soup going on here. So C would be a private insurance company covering your Medicare benefits. You're still on Medicare, but it's delivered by a different company. And it can include drugs and a little dental, vision, sometimes something like a Silver Sneakers program or whatnot. So as with a supplement, you're going to pay a monthly fee on top of your Part B. This can be various different prices, but we'll look at that in a minute. Option 2, Medicare Advantage plan, has 0 or very low monthly payments, but you pay as you go. So we say it's pay me now or pay me later. Option 2 is the pay me later. You pay as you go. You'll have co-pays, deductibles, and a network that you'll have to consider. So this works great if you've got drugs that are fairly inexpensive. Also, if you have doctors that you like to use that are in network with your plan, this can be a very reasonable way to access your Medicare care. So in option 2, you can choose from PPOs, preferred provider organizations, or a HMO, which is a health maintenance organization. HMOs offer only in-network coverage, and you need a referral to see a specialist. If you opt for a PPO, preferred provider, then you will have to pick a primary care doctor, and you can use in-network doctors at a lower rate, but you have the option to go out of network at a higher rate, and you don't need a referral. So there are flexible options with both of these, and there are many companies in Florida that offer each of these plans. What I do with Medicare supplements is Plan F, for example, has to be the same coverage from every company. So I try to find the most reasonable rate for a person, since they will be exactly the same. Medicare Advantage, again, this is a highly individual preference. We check your doctors. We can give you an out-of-pocket max. These have good coverage. What you do is you pay copays, deductibles, and you'll have an out-of-pocket max. Sometimes this can be $7,700. You would have to work hard to get that max out of pocket, except for a catastrophic illness or condition. Bruce, let's look at the supplements on the next slide, please.
Page 38 or 37?
37. Here we go. Okay. Excuse me. So here we have, these are just the supplement plans, A through N. F used to be the richest plan, and it still is if you qualified for Medicare prior to 2020. You can keep the plan if you got it before then, but if you are enrolling in 2020 on out, this isn't available. G, therefore, is the next richest plan. And you can see there that if you look down the column, just about everything is covered. There are no blank spots. The thing that is not covered on G that is covered on F is that Part B annual deductible, meaning the first, I think it's around $180 that you spend will come out of your pocket. So this is a very good plan for people. It's very popular. Someone mentioned the J plan. That also is not being sold anymore, but if you've had it, you can keep it. What I like to point out to people here is when you look at the row that says Part B excess charges, this can be a big deal. If you think of, say, an open heart surgery, for easy math, we'll say that it costs $150,000. Medicare may say, well, our rate for that is going to be $100,000. And they'll say, that's what we're going to pay. So you're left with the $50,000. The doctors come back and say, our malpractice insurance and other expenses are so high that we can't do it on $100,000. So we'll allow 20% over. So you can now have a bill of only $30,000, whereas they'll pay $120,000. That could really severely impact a family. So I like to point out one of those two plans for people who are shopping with supplements. These can be changed from year to year. Should you want a lower cost plan and then want to go upwards to a better plan, richer plan, you can do that. The advantage of buying a plan when you turn 65 is that A, you go in at the lowest possible rate and you stay in that category for the rest of your life. So if you signed on to a plan F 5 years ago, you're still at the 65-year-old rate. They can raise the rates, but they can't charge you extra because you use the plan a lot. So how can you enroll? Of course, everyone knows this is open enrollment period. This is the time each year where you can update, review your plans, and make a change if you wish. Now, when you first turn 65, you are guaranteed issue. You can even have diabetes and you'll still get a Medicare plan. If you go to a Medicare Advantage plan and come back to a supplement, you will have to undergo underwriting. So they are eliminating things like, have you been told to have surgery that you've not yet had? Have you had to have dialysis? Certain heart conditions. You won't be able to go back to a supplement unless you can say no to all of the underwriting questions. And these vary from company to company.
Carolyn, I have a question for you.
Sure.
So, because this is what I do, and so I'm seeing down here, skilled nursing facility, co-insurance 100% on plans C through G and M, they're 100%. Can you explain this further on skilled nursing?
Yes, that means that you are eligible for that after a hospital stay. And this is either in a facility or at home care. Most people would prefer to be at home. But if you have to go in, say you've had a knee replacement and you have to go to rehab, that would be covered under this section.
So it's 100%. So is there a deductible period?
No, the only requirement is that you have to have a hospital stay prior. I believe it's 3 midnights.
And so my understanding is that Medicare picks up the first 20 days, and then days 21 through 100, Medicare makes the individual responsible for about $170 a day. Is that right?
Yes, it varies according to the facility, obviously.
And then on the 100th day, Medicare ceased to exist. Is that?
That's true.
So where does the 100% play in then?
100% of the first 20 days.
The first, okay. So regardless, if you have whatever plan you have, after 100-day, Medicare stops.
Well, yes, it stops. You pay the full freight or a reduced rate actually, and then after 100 days, they take you off completely.
Okay. And also anytime in that timeline, if someone plateaus and is not recuperating and they're actually could be getting worse or not getting any better, then Medicare could potentially stop paying as well. Is that right?
They kick you off it if you're not making progress. That's true.
Okay. Thank you.
Anything else while we're stopped here? Okay, so enrollment periods, if you're just turning 65 or you've worked past 65 and you've been on a employer plan, if that stops, you are entitled to a guaranteed issue situation again. So say you're 68, you are deciding to stop working when you turn 69, then you can apply for and be guaranteed acceptance onto a Medicare plan, whichever you choose. Now, you will have to provide some kind of documentation for the fact that you were covered adequately from your employer insurance. Say you're turning 65 in January of next year. You have the 3 months prior, the month of January, and 3 months after to apply for a Medicare plan. If you're not collecting Social Security at that point, you will be paying quarterly for your Part B premiums. Any other questions while we're on this stop here?
Yes, I have a question.
Sure.
If you're being covered under your spouse's plan, who is not yet 65, I am way beyond 65. I had been on Medicare A and B, but I was eligible to go under her plan after several years, which I am still under, but I have proof that I was covered under her plan. So when I want to go back on Medicare, I just have to show proof for those years that I was on a credible coverage plan. Is that right?
Exactly.
Okay, thank you.
And you can also stop paying for B right now and just use that insurance depending on your individual situation.
Yeah, I'm not paying for B.
So to start Medicare, then you'll have to apply for B.
Okay, thank you.
Sure. Anybody else? Okay, well, I'll be happy to answer anyone's questions. Feel free to contact me if you have questions that you'd like to ask separately from this Zoom meeting. I'm available for checking your plan, making sure you're on the most reasonable plan. And I send letters to my clients every fall saying it's time to review. Now, by this time, people on Medicare have gotten what we call annual notice of coverage, or ANOC, and that will tell you what your plan looks like for 2021. If you like what you see, you don't have to do anything. It'll just roll over. If you want to see if a change is better for you, then you have the time between October the 15th until December 7th to make that change with a 1/1 effective date. So now's the time to look over your plan. And again, if I can help anybody out there, I'll be glad to do so. We make ourselves available at this time of year to help people out. Because your spouse has one plan doesn't mean you need to have the same plan. Same way with a drug plan. We tailor these to each person's unique needs.
So I will be sending Carolyn's contact information to everyone who's on this call. So you'll have her email, you'll have her phone number, and and again, I know the audio has been a little challenging this morning, so please, give Carolyn a call. She said she's all about educating people, and she's very knowledgeable about all this. So, please reach out to her if you have any questions, more one-on-one types of questions. So I'm going to thank everybody for being on this call. I know it was a little quick, but that's great. Sometimes short is sweet. So our next webinar will be in 2 weeks, and sort of a similar topic, but I have a specialist talking about veterans benefits. I get a lot of questions about, benefits that, how they relate to senior housing. So I thought it'd be very, very helpful to everyone to have someone who is an expert to talk about what benefits are available for our veterans. Glad everybody's doing well. Please reach out to me if you need anything as far as senior housing. Get out and vote, and do our civic duty and vote. And be well out there and be safe. So thank you very much. Thank you very much, Carolyn.
Thank you, Bruce.
Okay.
Thanks, everybody.
Bye-bye.
Bye.
Thank you, Carolyn. Thank you, Bruce. Really appreciated this.
Thank you.
Thank you.
Thanks, Bruce.